Welcome to Get Ready for the Dress. I am your host, Coach J. I am so excited to have you here with me going through this journey. We're going to laugh, cry. We're going to share life experience, have fun in the process. We're going to build a powerful, beautiful sisterhood right here in this safe place where we can share all of life experience. Talk about any and everything, whatever dress you may be facing. It could be a marriage, divorce, single parent, loneliness, singleness. I am here as your host. Thank you for joining us. So many of us face pelvic pains, and we're too embarrassed to talk about it because it can be from, you can be experiencing leakage from working out or just walking around. And you think it's a bladder issue, and it could be a pelvic pain or pelvic issue. But we're not educated enough to understand the difference. So let's get educated today on this podcast about pelvic pain and what causes it and how we can prevent it, what treatments we can take. And it could be treatments, non-medicated treatments. It could be exercise that could help. And they also have experts, pelvic floor experts. You don't go to your typical doctor for this. So stay tuned to the podcast. I'm so excited to bring this to you.
Hi, my name is Tulsi Desai. I'm a physical therapist and I specialize in pelvic health, pelvic floor, and women's health. And I practice in Coppell, Texas. My practice is called Active Body, Active Life, Physical Therapy and Wellness, where we specialize in women's health and overall women's wellness and their unique.
Great. Now, tell me, how did you get started in this field?
So I have been a therapist, physical therapist, since 2007. And of course, I'm not counting my educational years. I've been practicing since 2008, actually. And I was mainly an orthopedic sports injury, all the orthopedic joint muscle problems. That's what I was treating as a physical therapist for a while. And then I came across some therapists who worked in my company, in the same company where I worked, and they were doing women's health. And that's when I actually first heard about it. So it's weird. I had some idea, but I really didn't know the extent to how much it could help people. So that was my first encounter, and I really found it interesting, but I wasn't 100% sure if I wanted to do that all my life. So I practiced as an orthopedic therapist for a few years, just because I wanted to have a strong foundation before I started specializing in something else. And then I realized that there were missing links. There were things that I would try on most people, some strength training or posture and all that. And some people will respond really well, and then there were some patients, they just won't respond the same way, and I knew I was missing something. And that's when I decided I had to do women's health specialization to know what I'm missing and to help my patients better. And then I had also had a friend who went through a really traumatic pregnancy delivery, and it took her 1 year to heal from all the tearing and sutures and surgery and all that, and she was in so much pain. So I was seeing other women around me. I was listening to patients' story, how after childbirth, so many things change: your bowel, bladder function, sexual function, chronic back pain that just doesn't go away. Doesn't matter how many chiropractors you see, muscle separations and belly bulging out. And there were so many things that I didn't know how to treat, and I knew I had to go and advance my education. That's when I started specializing in it, and that was eye-opening. I just realized all the things I was missing out on because nobody was evaluating the pelvis. We weren't taught how to evaluate the inside of the pelvis and how to relate that to all the other regular orthopedic findings. So I love it. I mean, I'm so glad I chose that path.
That's good. That's good. Now, tell me, so
how important is it for us? I mean, what do we need to check every day, or how do we, give us some tips on what we can be looking for as women, knowing if we have this problem, the bladder or the pelvis problem? Because I mean, I never had kids, so
Yes.
I mean, I don't know. I have no experience in that area at all.
Yeah, and you don't have to have kids to have pelvic problem. It's just more prevalent in people who have had kids, just because that pregnancy itself can be considered a trauma. Body goes through so many changes, and not
Mm-hmm.
everyone is prepared for those changes. People just get pregnant thinking, and the world makes it look like motherhood is the best thing and it happens naturally, and it does for most people. But some people go
Mm-hmm.
through really rough pregnancy and really difficult labor or c-section, and it also depends on how their health was beforehand or what happened, all the hormonal changes and things that could go wrong during pregnancy and delivery. So uh, it's just more common after childbirth, but it can happen in athletes, gymnasts, dancers, professional level, or the ones who are fitness enthusiasts. They have pelvic floor issues too, and I'll go into more details later. But
Mm-hmm.
most people don't even know what pelvic floor is. So before we go into what should people look for, I think they need to understand what is pelvic floor. Why are we talking about it? Um,
Mm-hmm.
so pelvic floor is a group of muscles inside the pelvis, and we can't necessarily check them from outside. So regular physical therapists, chiropractors, they never palpate internally. So this is kind of similar examination as gynecologist does.
Mm-hmm.
It's an internal palpation, but women's health physical therapists don't use any instruments. We just use one finger to palpate internally to see what the muscles are doing. Are they working the way they should work? Are they super tight? Are there trigger points inside? Was there any tearing of the muscle? Was there if and patient's history will tell me a lot, and I would decide what am I going to check when I'm doing internal exam. So if somebody had sexual trauma in the past, or they have had very rough pregnancy, multiple babies, that tells me something, versus if somebody just had one baby, c-section, versus, like, we look into a lot of what has this woman gone through for me to decide this might be a possibility of what she's suffering from. And then my physical evaluation will confirm if I'm thinking in the right way, or do I need to look into more things to cross check. So most gynecologists don't check pelvic floor muscles. They are just checking your uterus and organs. And not most of them don't have training in how to evaluate pelvic floor muscles, what to look for, and all that. So people, if they think that, oh, my gynecologist checks me every year, I go for my yearly visit, that does not mean you're actually getting evaluated. Or if you're given an okay at 4 weeks, you're good to go, you can have sex now, you can go work out now, does not mean your pelvic floor has returned back to normal, because that's not what your gynecologist is looking at. They're not checking your strength. All they're looking for is, okay, you have healed the way you should heal, the way we expect you to heal. There is no bleeding, there is no reason, life threatening reason for you to take any precautions anymore. So now you can return back to your life. And now these are women who could have diastasis recti, abdominal muscle separation, or really weak pelvic floor, organ prolapsing, and all different kind of leaking bladder. And now they're allowed to go back to workout, but they're leaking every time they jump, they're leaking every time they lift weight, uh, or every time they run. So I have had patients who would not go to yoga class because they're embarrassed that they might not be able to hold the gas in. So, or they might leak, and they might stink, and people get so self-conscious and self-aware about all these things that it affects their self-esteem, and they don't want to do their fitness and yoga and Pilates due to fear of not being able to control their bladder or bowel, uh, or flaring up something, or if something is prolapsing, they could have this feeling of heaviness in their vagina, and it's just an annoying feeling, and they're not sure if they're going to make it worse by working out too much or lifting heavy weights. So now they stop being active, they put on more weight, they start becoming inflexible and hurt their back, and it's just a chronic cycle of leading down to more health issues, because now one thing is stopping them from doing healthier things that they should be doing in life. So pelvic floor is just basically group of muscles inside pelvis that will support all these organs: bladder, uterus, um, bowels, and there are three main functions: bladder control, bowel control, and sex. It has a role in intercourse and sexual function and delivering babies. So if anyone has any problem with any of these three functions, they might have pelvic floor problems going on, and they need to see a physical therapist who is trained in women's health or pelvic rehab, and not just a regular physical therapist, because there is a huge difference in the specialty. And in my knowledge, no one else is trained enough to treat pelvic floor problems except pelvic floor physical therapists. So that's all I can recommend at this point. So there are multiple things that could, or problems that could occur. So abdominal muscle separation is one thing that could happen in athletes as well as postpartum. There is organ prolapse. Most people don't know unless they have it, but it's basically the bladder could be prolapsing, like it's basically sliding down into the vagina because it's not being supported well, either from delivery or from wrong habits. There are heavy weightlifters, gym enthusiasts who are not breathing correctly for years while they're doing this heavy training and trying to build up their muscles. Their breathing is creating so much intra-abdominal pressure and intra-pelvic pressure that they are pushing their organs down, and they are creating prolapse without pregnancy ever affecting them. Now, if they have these habits and they and they work out after pregnancy without ever reevaluating if their pelvic floor is strong enough to tolerate that, they're just fast forwarding this process. Even if the delivery itself did not cause the prolapse, their habits and their wrong patterns of breathing during workout are leading up to a prolapse in a lot of athletes, and even dancers. So please interrupt me if you have any question.
No, this is good. I didn't know that breathing, you had to have, I mean, I breathe when I work out and stuff like that. I
Right.
know how important that is, but I
Yes.
didn't know that can push your organs down if you don't breathe.
Yeah, and there are a lot of high, it's also personality type as well. There are some people who don't work out as much, but they hold their tension in their body, around their neck, around their inside their pelvis, especially women. I'll talk about women. I'm not saying men don't get pelvic floor problems, but I don't specialize in men. I have friends who do. So if somebody has a question or they think they might have something going on that I'm talking about women, but a man might have similar symptoms, they can contact me and I'll refer them to a specialist who treats male pelvic floor problems. But women just are more likely to have it because we have extra hole, and there are just things that could slip out of it. Nobody thinks that way, but it does happen. And that's why it's important to know it beforehand, prevent it. If you're suspecting it, right away address it, rather than wait until it's so bad that you actually need a bladder lift or hysterectomy. Somebody has to remove organs from inside your body because now it can't stay in place. So those are extreme procedures, and they're so easily uh, sometimes treated, if I get the patient, or if a patient finds the help at the right time, rather than wait until it's really bad. And even at that point, some people may not be a right candidate for surgery and they are being told to live with it. Then we can help manage their symptoms and improve the quality of life, even if we can't necessarily reverse the problem. So
So how can you help them? How can you help with that if they was told to live with it? How can you help them live with the problem?
So we can still improve the muscle strength at any point, even if it's a 90-year-old woman. I've treated women in their 90s. I have had one woman who was 78-year-old, had urine leakage since her first baby at 23. So more than 50 years ago, she started leaking. And she was just so embarrassed that except her husband, nobody knew about it. And she never ever mentioned it to her gynecologist or primary care physician because she was just ashamed that she had that problem, and she thought she was the only one who was suffering from it. She never even discussed with her friends to realize that, my friends might have same problem. But overall, urinary incontinence or leakage is very, very common, most common problem, pelvic floor problem in women. And 80% women after vaginal delivery, and if they had tearing, any kind of tearing, they could suffer from urinary incontinence temporarily or for a long time. 1 in 10 women have some kind of postpartum incontinence generally. But 80% women have tearing, and then their just likelihood could be slightly more. And then in a long run, it can also increase the chances of organ prolapse, because it's kind of a sign that there is some kind of incoordination or muscle weakness going on, which can then eventually stop supporting the organs as well as it should if it goes untreated. In United States, 25 million people suffer from urinary incontinence, and 75 to 80% of them are women. So out of 25 million, some of them might have stroke. That's a neurological damage. It may have nothing to do with what's happening to the muscle, but majority of them would be muscular dysfunction and not neurological dysfunction. So there are so many women we can help if we can just, first of all, raise awareness that this is a common problem and nobody's talking about it. I have had patients go to doctors and tell them that this is a problem, and they are being told, you had kids, what do you expect? Live with it. Or I can operate on you when it gets too bad, or I can give you some injection or medicine. And they're just not ever sent to pelvic floor therapists. And a lot of these doctors know that this is an option, and they still won't refer the patient out. I'm not saying all the doctors are like that. There are so many doctors that do send patients out, but it's a very small percentage when you look at it in a metro area or nationwide. It's a very small number. And
So can we ask for referral?
yeah, and I have told patients that you have a right to demand that I want to treat this with physical therapy, and I have found somebody who can help me, and I want you to write me a prescription. First of all, you just go and ask, is physical therapy helpful in this condition? If the doctor says, I think it's all psychological, it's useless, I would actually question if I want to see that doctor ever in the first place. But that's just me. People can decide for themselves. But this is proven scientifically. There is enough research out there that physical therapy can help with this, and we can help. And I can talk about what all things happen when this is ignored for years. But so you can ask, can I do this, and see what their opinion is. It will tell you a lot about your provider. And if they have no clue, and especially if it's a primary care physician, a lot of times they may not know it, because they're not gynecologists. They're not doing this all day long. So you can educate them and say, I want to try physical therapy. They know what physical therapy means, and get a prescription. If they're saying no, go to your gynecologist. If that person says no, I would really question if I want to stay with their doctor, and then just find somebody who will write you a prescription. But in general, a physical therapist can evaluate you without needing a prescription in Texas state. So we don't need to wait for a script. A person can come and get evaluated for me to even figure out, can I help this person in the first place? If I can, then we can go and get the script. But if it's not the pelvic floor problem, why bother? Why go through all that trouble? And I do screen patients for free over the phone. So sometimes I can just tell, you need a referral out to somebody else, because this doesn't seem like a pelvic floor problem. I don't allow walk-in visits in my clinic. I have to screen every patient. Only if they qualify for my services, then they would come in, because I don't want to waste their time or my time if it's not the right solution for the right problem. So yeah, 1 in 4 women over 18 years of age experiences involuntary urine leakage at some point in her life. And generally it takes 6 to 8 years for a woman to even find a physical therapist, or even learn that there is a pelvic floor physical therapy specialty before she gets help, because she just goes from one doctor to the other doctor to the third doctor, and maybe find the fourth or fifth one who tells her, why didn't you try pelvic floor physical therapy until now? So I'm not saying there are not doctors who are not referring it, but it's just a very small percentage. And I have met some doctors who have had either a sister who is a physical therapist and pelvic floor specialist, and they realize, oh, I didn't know this, and they become a big proponent of pelvic floor physical therapy, because they learn it from their sister. Or some of the doctors have had pelvic floor issues themselves. They went through treatment, and then they are a firm believer in how much it was able to help them, and then they start. And then some doctors just get trained in institutes, which is training them into this kind of practices, and they just learn to start sending patients to physical therapy before going into surgeries or heavy medication and all that. So it really comes down to their training, their experiences, and their judgment, because we all have our opinions and judgments about everything, different things. So just find the right doctor who can help you, but also stay informed. Google has a lot of information. There is a lot of wrong information, but there is a lot of helpful information too. So just researching pelvic floor physical therapy will at least help you understand a lot more than what you would learn from this. Anybody would learn from this uh, podcast, because we are just going to cover tip of iceberg. There is so much more to it.
Right.
So if somebody is suspicious that they might have some problem, they can go online and look it up a bit for their own mental peace, if they want to learn more.
Yeah.
Or they can go on my website and learn some more, or they can call me. I even have some videos on my website on different topics, so people can like, all that is free material. So and a
So
lot
they
of,
can
yeah,
educate themselves and then they can make an appointment. But let me ask you this.
yeah.
How long pelvic physical therapists or therapy been around? How long you guys been around? I mean, is this like so new, 10 years new to the market, or you just been around a long time and people just not familiar with it, or what?
I think so. If you look at orthopedic, neurology, pediatric physical therapy, all that has been around a lot longer than women's health physical therapy. It's a new emerging field, but at least for last 20 years, people have had enough awareness on pelvic floor physical therapy. It's just not marketed enough, and traditional doctors haven't adopted this. Like patients are still being sent for regular physical therapy. If somebody has fracture, muscle tear, surgery, knee replacement, every single person, back pain, they're being sent for physical therapy. But the people dealing with pelvic floor, the first providers who come across the pelvic floor problem, they still haven't adopted that referral practice of sending patients for this alternative treatment that is natural, uh, and people can learn self-help tools that they can practice for rest of their lives, rather than relying on a surgery to passively lift an organ and keep it in place for a few years. And the gravity is unforgiving. It's the things will, like, organs will start sliding down again, because after surgery the muscles should still have been strengthened. Just because an organ was lifted and put in place, the mechanism of weak muscle is still not going to support that organ, and eventually a few years down the road a person needs second surgery. So if you look at knee replacement, hip replacement, those are surgeries, and every single patient, it's a standard, gold standard practice that they are sent for physical therapy, period. And it would be a malpractice if somebody wasn't sent and the surgery failed or got complicated. And I think it should be the same for all pelvic floor and abdominal surgeries, where it can disrupt a person's nervous system, muscle coordination.
Yeah.
I have had patients where they had miscarriage, and they had to have DNC, and after DNC they started leaking urine. So it wasn't the pregnancy, it wasn't the miscarriage, it was the procedure after which the muscles were disrupted in some way, and now they lost their coordination and they're leaking. And it's so easy to bring that coordination back with some professional guidance. And I've had patients where I have had one patient, she was suffering for at least 20 years. No, longer than that. She had giggle incontinence. So in young teenage girls, sometimes when they giggle, they would leak
Right.
like abruptly, and that's a sign of pelvic floor dysfunction. If young girls can't insert tampons because it hurts so bad, I mean, not young, but like teenage girls, that's a
Yeah.
sign. That's a sign that they might have some pelvic floor dysfunction going on. And the sooner, I mean, we don't. If it's an underage girl, we won't do any internal treatment unless they have already had OBGYN exam done, or if they're already sexually active and parent is there and we get permission. But generally we try to avoid any internal work for young girls, but we can still train a lot of things and give them tips to follow. And so this lady never knew about this. She just thought she had a problem. So I found, she came to my workshop and she was 53 or something, and she only needed 2 sessions and she had full bladder control. She never, like, she would even leak when she would laugh or sneeze or go to like Pilates class or something, and she always had to back off on certain things because she knew she would leak. And just 2 sessions. Now, when she came to me, I wasn't sure it was a 50-year-old problem or 30-year-old problem, that I could fix it in 2 sessions. So sometimes it also depends on your genetics and overall fitness and mind body awareness, and your awareness of your own body. Some people have really good
Right.
awareness and some don't. So we do look at all that, and kind of, and I've had patients who have come for 15 sessions, but that goes on for months. Like, they're not seeing me 2-3 times a week. Generally, most of my patients see me once a week or once every other week, and in between they're working on their homework, any stretching or strength
Okay.
training or muscle relaxation that I've taught. So a lot of uh, people who exercise a lot, some type A personalities, dancers. So a lot of them have learned to overuse their pelvic floor. So they may not have weak pelvic floor, but they're using it constantly, and they don't know how to relax it, that their pelvic floor
Mm-hmm.
fatigues at a wrong time, and they could still have leakage. They could still have prolapse because they're creating so much intra-abdominal pressure during workout, and they might be walking around with like overactive pelvic floor. So even just with daily
Mm-hmm.
activities, picking up their kids and stuff like that, that over the period of years, that pelvic floor can become shortened and weak because it doesn't transition through full length ever. And then they have a different problem than a loose and um, stretched out pelvic floor, and which is still weak.
Right.
So just because somebody is strong does not mean they are coordinated or they're using the body correctly. I could be strong, and rather than pushing, I can keep pulling and think, why is this thing not moving?
Right.
I can keep pulling the
Right.
door that needs to be pushed, and it will never open. So it really depends on knowing when to do what, when to relax the muscle, when to activate it during the workout. And there are so many CrossFit athletes who leak, and they look at it as if it's a medal or something. Like, they think that
Yeah.
that's a great thing, that they work out so much that to the point where they leak. That just goes on to show that they are predisposing themselves to an injury in a long run,
Right.
and then that would get them out of working out, because pelvic floor usually affects lower back. The abdominal muscles and pelvic floor muscles work hand in hand. So one gets disrupted, the other is going to get affected very easily. So after C-section, the abdominals are disrupted. They sometimes turn off because of all the damage, not damage, but all
Mm-hmm.
the trauma, and that can also affect how pelvic floor works properly or not, even though that person never had normal delivery, because the abdominals are now in turn affecting the pelvic area. So some of the questions one can ask, and if they say yes to, so I'm just going to say maybe 7-8 questions people can pay
Yeah.
attention to, and see if they have an yes to any of these questions, and know whether they might need a consultation or not. So if someone feels uh, pain in the pelvic region while sitting, they may have some tailbone issue from pregnancy or from some falls. I have had so many patients, they come in with some pelvic floor problem, and when I take their history, a lot of them have history of falling on their tailbone, injuring their tailbone from a
Mm-hmm.
bike ride or bike accident, or falling from tree, or uh, just weird histories, falling from staircases.
Right.
And that happened years ago when they were teenagers, and they don't even remember it until I ask them. And that could have been a start where they start, because pelvic floor muscles all anchor to tailbone. So if tailbone has been injured ever, that may have turned the pelvic floor to work into some weird fashion that never bothered them until years down the um, years later, where it can't cope anymore, it can't handle the stress anymore, and it starts giving symptoms. So any pain in pelvic region, in sitting, standing, any position, especially sitting, can mean there might be something going on. Painful scar from C-section, abdominal surgeries, or childbirth,
Mm-hmm.
episiotomy. So it's the vaginal tear and stitches. All of those painful scars. Pain itself can lead to neurological changes. So if somebody had sexual trauma, for example, they didn't have any tearing or anything, but the trauma itself can change how they're activating their muscles, or if they're ever relaxing their muscles, or or if they consider that area as a black box and they don't want to think about it, it just doesn't exist for them. And now it could have some emotional as well as physical dysfunction going on, and we need to address both. And some of those patients need to be in counseling along with physical therapy, so we can address their mind body connection and not just force somebody into something they don't want to do. So it does come down to patients' willingness and motivation to get better. And that's why it affects women so much, because we have so many ways body can be traumatized, unfortunately. So then any pain during or after sexual intercourse is a sign there must be something going on with pelvic floor. And if somebody describes the pain to me, I can say, you know what, this needs to be addressed by the gynecologist, versus it highly feels like it's pelvic floor, and I can evaluate you and confirm it. So that's where I screen people over the phone, just to make sure if they need to see somebody else, they don't need to waste their time coming to see me. If somebody urinates more than 8 times a day, so if they go to restroom, if you have any friends who go every half hour, every 1 hour, that's a sign that their pelvic floor is not functioning the way it should. So ideally, a normal adult goes to restroom every 3 to 4 hours. So if somebody holds it for 6 hours in a row because they don't like to use public restroom, they are setting themselves up for pelvic floor dysfunction, because now the bladder is full, they are overusing their pelvic floor, and they're disrupting the whole urinary reflex. So every 3 to 4 hours,
Good.
everybody,
Good to know.
yeah, because a lot of women do that. They just don't like to use public restroom, and then and some people just like don't sit on the toilet seat fully. They're squatting and trying to pee, and that also disrupts the pelvic floor, because pelvic floor needs to completely relax for the bladder to completely empty. So if somebody feels like I can't fully empty my bladder, I can't start urination, hesitancy in starting urination, frequency, urgency, all these are symptoms. And people will mostly go to urologist, nephrologist, like mostly urologist, urogynecologists. And a lot of times these are such simple things that could be treated with pelvic floor. And when you end up in an expert's office, they're going to run every single test, and your copay deductible and all that will go towards that, and they'll find nothing. So a lot of times just ringing up a physical therapist to see, do I need to go see a urologist, or do I need to come see you? And we can just screen that over the phone, that yes, this is easily treated by muscular problem. It's a muscular problem, versus no, this doesn't seem like muscle problem. It's weird. I think you need to go see a urologist, because they can run more tests and they can check what's going on with your bladder or whatever. So if somebody experiences sudden sense of urgency, like if you're sitting in a movie theater, or if you're in a meeting and you get the urge, and you know if you don't make it in time in next 5 to 10 minutes, you're going to start leaking, or you might lose full control. And I have had patients tell me stories. So those are early signs when somebody has severe urgency, frequency, which will end up in some kind of incontinence later on if they keep ignoring it, which is what a lot of moms do, because they just have so much on their plate. They have no time to go consult for their own problems until they can't ignore it anymore. And at that point, we can still treat it. We just don't know if the outcome is going to be 100% recovery or 80% recovery, based on how long that has been going on and what are the factors affecting it. But in most cases, people have really, really, really good chance of getting better, because muscles can be treated at any age. They can be strengthened at any age. They can be stretched at any age. And that's where we are promoting geriatric fitness these days, because the stronger our older population is, the stronger their bones will be, and balance and overall life quality. So these are same muscles, just in a different location, and we can train them at any point in life. Any vaginal heaviness, that could be a sign of prolapse or something else going on, and we need to evaluate that. It's not normal to feel heaviness in the vagina. And multiple urinary tract infections. So some people get UTIs every few weeks, every few months, or some people get it after every sexual intercourse encounter. So, and they need to take antibiotics. A lot of these are signs of pelvic floor dysfunction. So if somebody has UTI, it goes away, and for next 5 years, they never have UTI, or even for a year, they never have it again, and the second time it happens, it could be dehydration. It could have been their immunity was compromised or whatever. But if somebody is getting it once every few weeks or once every few months, and they have to keep going through this antibiotic, which is just helping them temporarily. We need
Right.
to look into pelvic floor, and a lot of primary care physicians have no clue that this could be going on, unfortunately. So they just put people on, the minute UTI, the urine test comes positive, they'll just put people on antibiotics rather than trying physical therapy. And again, I'm not saying every UTI can be treated, but if somebody has a history of multiple back-to-back infections, antibiotics are not going to help them. It's going to mess up their abdominal flora and create other side effects. Uh, and I'll tell you just one logical reason. Like if somebody has wet underwear, or if they're wearing pads because they know they've been leaking for a few years, that area is perfect for growth of bacteria. So it's wet,
Mm-hmm.
it's warm, and like it's perfect for bacterial growth. Now, when your urethral opening, that's the urinary opening, is constantly exposed to those bacteria, at some point your immunity, if it's compromised, or if you're, and then when pelvic floor muscles are incoordinated, it also tells us nervous system is not doing its job. So the nervous system may not be detecting the infection. Like you are basically constantly exposing your system to fight this bacteria, and at some point it will infect a person. And the longer, so I had this 78-year-old patient. She never told anybody for 50 years. She was getting back-to-back UTIs, and doctors kept treating her for 6 months. It was getting to the point where she would have high grade fever every 2-3 weeks. Once she stops antibiotic, she's in bed, she's starting to lose her muscle strength and balance and all that, and she's the caretaker for her husband, who was like 85 or something. So she knew she had, so finally I guess somebody realized, you know what, let's try physical therapy, because what we have done for 6 months didn't help. When she came to me, she had
Right.
no awareness when she was leaking. She was wearing diapers. Every 2-3 hours she would have to change her diaper because it would be fully soiled. So I didn't know if this was a
Oh, wow.
neurological damage or just muscular, but I don't give up on people that easily. So I told her, let's give it 2 weeks and see if we see any
Yeah,
improvement, and you have to promise you're going to do your best if I give you some homework. And she was motivated. in in 6 to 8 weeks she had full bladder control.
that's
So
good.
if 78
So
year
it
old
can, so
with 50 years of history with no bladder control can get full bladder control back, I mean, other people have so much more possibility of 100% recovery.
so there is hope out there for us ladies. We can take control back. We can take control of our bladders. No more leakage. We no more being ashamed or afraid or
Yeah.
embarrassed. No more of that. That is awesome.
And
That's
no more
awesome.
bearing through pain during sex, because there should be no pain during sex, period. During intercourse specifically, because that is normalized so much. Like I have heard from so many women, oh, I just thought that's normal. I mean, it's not horrible, but yeah, I don't enjoy it. So
Mhm.
we need to speak up when we are uncomfortable. And I mean, I know it's a controversial issue, but it's a medical problem. It's not in your head. And which is what a lot of women are being told by their doctors, it's all in your head. Drink wine, loosen up, take Tylenol. And that's not going to help them. It's a muscular problem. It could be a nervous system problem that we can correct easily. And I've helped so many women go back to pain-free sex. So these are just things which are not discussed within medical field. They are being ignored, and I'm trying to educate women to not take it as normal. Leaking is not normal. Nobody, even at
No.
95 100 years old, should ever leak with coughing, laughing, sneezing, or running. We all are capable of having full bladder control.
Yes, we are all capable of having full bladder control. You heard that, ladies. So this has been really good. You gave us a lot of good information, a lot of good nuggets, stuff we need to know, stuff we need to go and research, stuff we need to take action on. So I mean, even myself, I'm sitting here going, "Wow, I didn't know that. Wow, I didn't know that." So it's just this has been good, and I can definitely hear the passion in your
Oh, thank
voice for this, uh, just teaching people and and helping women fix their minor
you.
problem and then being educated with it is on top of that. So this has been really good for us to learn and learn more about it. So one thing, how tell
Yeah.
me, I'm sorry, how how they can, if anybody wanted to reach out to you in the Dallas-Fort Worth area, how we can reach out to you. And not only that, I have your information on the blog, so they'll be able to go to the blog and also look at your information. But go ahead and tell us your information, your Facebook page, your website, not your phone number, but your website.
So again, my business name is Active Body, Active Life, Physical Therapy and Wellness, and my Facebook page is Active Body, Active Life, and my Instagram is the same, Active Body, Active Life. And I would really encourage people to just follow it, go online and like or follow that page, because some people may not have problem right now, but as we know, a lot of women go through it at some point in their life. So just having those updates from those social media pages will be a good reminder when something happens, or it will be a learning thing, that at least you keep yourself updated if I post something educational. But yeah, so those are my social media pages, and my website is www.activebodyactivelife.com. And I would love to talk to anybody who is not sure what's going on and guide them. Even if I need to refer people out, I can refer them to somebody I trust, so that way they know they're being referred to people who I don't refer to somebody I have no clue. I'll tell people, look, I don't know who to send you to, or I'll inquire and I'll get back to you, but I won't refer to a person that I haven't met or I don't trust. So I have a list of referral sources that I know how they practice and how ethical they are, basically.
That is awesome. Thank you so much for taking the time doing this with me and educating us. Like I said, I have notes. I know what I need to be looking out for. I know how to treat some of my clients now if they have this problem, and who to refer them to. So
Yeah.
thank you so
Thank
much
you.
for being on,
Thank you for
getting us dressed for this.
Thank you for
Oh yeah,
inviting me.
no problem.
I
You
really
are
appreciate
welcome.
that, and I was trying really hard to not go over time. I know, and I was trying to keep it very concise and to the point as much as possible.
No, you're good, girl. I know your passion. I know you're passionate about this, but you're good. We're just going to keep, get them following you, get educated. And like I said, as I learn, people that need your service, I will definitely be
Thank you.
passing them
Thank you
on
so
to
much.
you.
And again, you'll be helping them get better. So we all just need to do our part. And I'll add one more thing. If there are any women's groups or business groups or personal trainers who would like to learn, help the population they serve, I would love to do any kind of um, training or webinar or anything that people are interested in. So feel free to reach out to me, because the only way I can help more people, even if I'm not directly treating them, is by spreading awareness. And I just love doing that. And I do telehealth, so I can treat anybody in Texas state. So they don't have to be from DFW area.
Oh, great. Okay. Good
Okay.
to know. We'll have a
welcome to our lunch chat with Jeniece. I am super excited to bring her on today and share with you her message, because I think it's powerful that we start sharing these stories of overcoming things, because we all have struggles, we all have a story, we all have things that are going on in our life, but how do you get out of it? And how do you thrive and create a successful life? Like, how do you do this? How is this possible? And I think I was at that place a long time ago where I felt that nudge. I felt like, life was trying to pull me in another direction. But I was like, what do I do? Like, what's going on? Why am I feeling this way? So I am going to bring Jeniece on, and I want her to share her story with you. So welcome, Jeniece.
Thank you, Jenny. Thank you for having me on your show. It's such an honor. Thank you. My name is Jeniece. Like she said, I started out as a child not liking the life I had. There was nothing wrong with the life, but when you're been shaken from something you used to, like my parents, when I was 9, my parents had got a divorce. And I was 9, and I was used to my dad being at home, because I was a daddy's girl. You know how that is, a daddy's girl. And my world was shaking. So I took it out at school. I had anger problems. I had anger problems when I went to school. They couldn't teach me nothing because, you know what? I had an attitude because my world was shaking. So what that did for me was labeled me. I became a label. I became a labeled child. I became a child that didn't want to learn, a child that had an attitude problem. And what do they do with label kids? They set you aside. So they set you aside. So basically, I did not, they put me aside, and then I didn't apply myself. So I'll take my ownership. I didn't apply myself. So what did that do? That hurt me along the ways in life. When I got in high school, I was still labeled. I was labeled until I graduated. And they just graduated me. So they didn't graduate me because I earned it. They just graduated me because they were tired of me, you know. So that hurted me in life. And then I started having the feeling of I would never be nothing, or I wouldn't mount up to anything because of being labeled, you know. I started owning the label. I started acting like what they gave me, you know, the label they gave me, because that's what I knew. I knew that, and that's what they said, and I took what they words literally. I took it.
Bringing me, I'm getting tears like right now. Like I feel you, because I know, I'm like, you're triggering something to me, because, you know, I had the same thing growing up, but labels, I cannot stand labels.
Yeah, exactly. But you know, because you more than that. But what, I had a powerful praying grandmother who prayed for me, and she would always say, not that, rebuke that. No, that's not that devil. You know, you're better than that. And I had to believe that, though, Jenny. I had to believe that, because I believe what the school told me. They said, you'll never be nothing. You'll never be able to mount up to anything. You'll never do anything in life. You're going to have 5 kids, and you're going to be on welfare. That was said to me. I have no kids, never been on welfare, thank the Lord. But I start believing that, because that's what was fed to me. You know what I mean? Because no one wanted to take the time in the school system and challenge my disabilities, which was not a disability, but to them. You know what I mean? So I walked around with that for a long time. But it was, like I said, I had a praying grandmother who knew the Lord and believed in the Lord. And she started, and my mom as well, my mom and my dad would always tell me, you can do anything you want to do, you put your mind to, you can be anybody you want to. So they was feeding positive things, but you at school more than you at home, right? So you got all that negative enforced. And then not only that, the circle you run around with, the circle, because, you know, you trying to be with the in crowd. So, you know, you still got that negative feed from that circle too. And the teachers that labeled you. And then you come home. So you got that small support at home. When I said small, because, you know, you're getting enforced at home, but the hours are not adding up. So I was just, you know, I believe that. But what happened, my turnaround point was, I never forget, I was a senior. No, I wasn't a senior. I was 17. I got jumped by 6 girls. Jumped me, girl, cut my face up. And I never forget, my grandmother said, she had me to pray. She said, I need you to get on your knees and pray now. And pray the anger out of me, the bad attitude, you know what I mean? Because I still had a bad attitude, because my parents are still separated. I'm still living, you know, I'm living with my mom, but I still go see my dad. I have 2 little sisters under me. So I still have this attitude. I'm still not completely, you know, understanding. So I never forget. So I prayed. I never forget. I prayed, and I was like, Lord, you're going to have to change me. You're going to have to change me. That was the starting point. It wasn't my turnaround, but it was the starting point. I moved from Indiana to Texas. When I moved to Texas, that, I believe, was an eye-opener for me, because my parents got back together. And then we moved to Texas. And when I moved back to Texas, I had to deal with new people, right? So I no longer, that label, I still had it, but it didn't really exist because I'm in a new place, right? So I'm in a new place, new school. I got a chance to turn things around.
How old were you when you moved?
I was 17.
And was it because of like their job that made you move, or?
My parents got back together and my dad lived in Texas.
Okay. Okay.
My dad lived in Texas and my parents got back together, but I was 17. I started a new school. So I did. I was able to turn that label around. I started with a whole different school, whole different group of people. I didn't try to meet anybody. I knew a handful of people. I tried to keep a good straight and narrow path with the teachers, you know. So when I graduated, like I said, they graduated me because I had a bad my GPA was not good, but they had a program here in Texas called the workforce program, so I was able to get on that program and graduate through that. But when I started in the real world, that's when my challenges is really start showing up because I didn't apply myself in school, and then they didn't try to help me in school. Is when my challenges started really showing up. So I had to self-educate myself. I had to get books. I had tapes. I had the little microphone I carried around. I would speak everything into that. I would listen to audio books so I can pronounce things correctly because I could speak, but I didn't learn anything. So I had to self-educate myself. So I had to get audio books. I would listen to audio books. I would look at the news. I would look at speakers to make sure I was speaking properly and pronouncing things correctly. So I went through 5 to 10 years of that before to feel comfortable, to even talk around people, because I used to be real shy just because I knew that part of my life was I was always afraid people would judge me or talk about me because I was not equipped because I had a learning disability or the challenges I faced in school. So I had to keep my mouth closed. Well, I didn't have to. I chose to keep my mouth closed because I was afraid to speak, and people may make fun of me or think that I was less educated, And then I would go behind closed doors and educate myself. And I did that. And when I tell you the feeling, that is still not a good feeling because I still felt like I was labeled. I still felt like it was, I was less than. I still felt like people were judging me. I was still wearing the label, that they gave me. I was still wearing it, even in my early adult years. And it was just, I would cry at night, I would cry and be like, Lord, girl, I'm about to get emotional. Be like, why me? What's wrong with me? It was very challenging.
You know how many people out there can really relate to your story right now that are literally today, right now going, why me? Mm-hmm. Why is this happening to me? Why do I deserve this? I'm such a good person. I'm doing this like I care. Like I'm not a mean person. Why is this happening to me?
Right. And girl, when I tell you, I would get good jobs. I would get good jobs, but I would be so intimidated because if you were just a nudge, like read a little bit better than me or write a little bit better than me, I was intimidated. I was like, oh, I'd start feeling like less than. But I'm going to tell you, I call myself a Moses. This is what God gave me. He would say, you are better. He would give me assignments to do. And I'd be like, Lord, this is where Moses would come in. I'd be like, Lord, I can't do that. I can't talk. I can't write. I can't write that good. I can't talk that good. I can't speak that language. And he will always say, I have an errand for you. You can do this. He will always give me the strength and show me, you can do this. And I would push myself a little bit further, and I would go a little bit further. And it was just because I had a relationship, an unknowing relationship with him. When I say unknowing, I didn't know what a relationship with the Lord was, but I just knew I would talk to him. And and I would feel the strength from him. But it was was because of him, girl, that I can do that. And I never forget when he came to me and said he wanted me to go to college. Jenny, girl, I'm telling you, that was a 3-month battle. I was like, Lord, do you know how I graduated? I graduated with a 2.1 GPA. You know, that's.
I don't even know my number. I don't even know my number. I was so bad at school.
Jenny, so you know what I'm talking about. I'm telling you, girl, he was, when he was asking me, I cried for 3 months. I said, Lord, I can't do that. You know how I am in school. I can barely, you know what reading level I'm on. You know, I cannot do that. For 3 months, people were coming to me that I worked with, was giving me pamphlets for university. They didn't even know I was going through this struggle for 3 months. They didn't know I was 3 months at home just like bawling. I would literally cry when it would just boil up in me. And I was like, Lord, I can't do that. These people are smarter than me. I'm going to be behind. I'm an adult student, girl. And then when I submitted and I went to school and I did. I got my undergraduate. It was a challenge. It was a challenge because I still had to, because I have dyslexia. I can't even say it. You know, I have that, which back then you were either smart or retarded or dumb.
Okay, I was labeled that in school, and you were either smart. I think it's because of our age.
Yeah.
So where we were, you know, growing up, that was the same for me. I'm not dyslexic, but I do have ADD. Like, I know I'm like either ADD or ADHD. I've never been labeled or diagnosed, but girl, my mind is going, woo, I got like a million things going on. And I don't know if I told you this, but I failed out of my freshman year of high school. My guidance counselor called me down that year and said, you know, what happened? What happened this year? I go, what do you mean? Right. And I was all cocky and everything. Like, what do you mean? What happened this year? Freshman year's done. Yeah, peace out.
Right.
And he's like, what? He's like, girl, he's like, that attitude ain't going to get you anywhere. He goes, just so you know, what you did this year, you will not graduate with your class of 1990. And I was like, man, he put a foot in my mouth. I was like, what? Like, go back. Like, excuse me, what did you just say? Can you repeat that?
Wow.
And he's like, you don't have enough credits to graduate with your class. I'm like, all right. Okay, hold up. What do we need to do to fix this? How can I fix this? He goes, well, you're going to have to take 2 years of night school and 2 years of summer school to get the credits that you need.
Wow.
And I was like, all right, done. Because there's no way I'm going to be a failure. I will graduate with my class. There is no way I will graduate with the class of 91 or anything. No way I'm going to get this done. But it was like that minute right there when he told me that I was not going to graduate. I was like, I better get my stuff together. Wow. I struggled.
Yeah.
I mean, I was not an honor roll student.
Yeah.
I was pulling C's and D's and B's maybe or whatever, you know, or like A in gym, right?
Yeah.
But like, I get you. I was there. Like, school's not my thing.
Mm-mm. I'm telling you, girl, it was and I think for me it was a challenge because I was still dealing with what, you know, my parents being separated, divorced, and then the second child attached to my dad, having 2 sisters under me, you know, and I didn't have to play the big sister role. I chose to play the big sister role. I wanted to help my mom, you know, so I wanted to, you know, I had all that to deal with, which was, you know, my choice in some areas, you know what I mean? But the thing is, when I went back to school and school, undergraduate was hard for me. It was hard because I still had not recognized my challenges. You know what I mean? I knew that I had a learning, I ain't gonna say learning problem. I knew I learned different than most people because I self-taught myself. So I knew what it took to get me to do things. But the teachers that I had to, you know, at the university, they didn't know. They had to get to know me. But the glory is I had some loving teachers at Dallas Baptist University that took to me, and they understood because, I mean, they understood and they helped me, and we had recognized the different learning patterns I had. and they were able to help me and give me resources and stuff. Girl, when I tell you I use all my resources, I use all. They said go to the learning center, went to the learning center. So I use all my resources. So that was able to help me. So that helped me a lot in my current life now, you know, because if I would have kept fighting the Lord on that, fighting him on going back to school, I wouldn't be where I'm at today, because that helped me to get a jump start. Because that not only helped me get a jump start, I went right into the master program. I got 2 masters. I got an MBA and a master's. And because I said, Lord, okay, I got so in the zone. I was like, well, if you want me to finish this, I'm finished this. I got to have another degree. I said, if I do this, then I can't stop with this one. I can't stop with just the undergraduate. I need to keep going till I get Dr.Jeniece under my name, which I am enrolled in a PhD program. But that's what it was. Girl, it was, but you know what? You have to push through no matter what. You have to take the naysays and show them through the glory of God that things can be better than what they say. You know what I mean? Because if I would have stayed in the label, then I wouldn't have moved. I wouldn't have done anything. You know what I mean? I would have just been the label that they gave me. You're going to be nothing. You are, because they took me from regular classes and put me in special ed, girl. Special ed. And I tell people all the time, just because you was in special ed don't mean you ain't special. I'm special.
Exactly. Oh my gosh. Yes, I love that. Oh, your message is so powerful.
Thank you, girl. It's the truth. It's who I am. It made me. I wouldn't have it any other way, because if the drive I have for life, for my business, for people, to help people, it's because of what I've been through. And everything we go through is never for us. It's always for someone else. And that's what the words say. It's always for someone else. So I am here to lift up my sisters and my brothers and show them what is possible. Because let me tell you, like I said, I self-educated myself. When I self-educated myself, I was probably on a 4th or 5th grade level of reading when I started. And I was an adult self-educating myself. And then went on to college. And when I say I graduated with both of my masters with a 3.6 GPA. 3.6. Now that's better than what I had. But you know what? I challenged myself. I applied myself. I believed in myself. I broke the labels off for me. I no longer let them hold me hostage. I just said, you know what? I'm better. God got me here for a reason. I'm here to be more than what someone else believed in. I have to believe in myself. I know, because he believed in me. Because everything he has me to do is beyond my reach, girl. Beyond my reach. Beyond what I thought. I wouldn't, people who know me back then, even my closest friends, they're like, girl, if only people knew how you were about school and the things that were said about you, and you are accomplishing these things. It's because it was always in me. I had to pull it out and believe in it. It's always in you. It's in us. We have it. We have to believe, and we have to pull it out and push through in spite of everything. Push through. Because that's what exactly it was. I had to push through. And even days like, we still have challenging days. There's days we get up and we're like, not feeling it. Those are the days we have to push it.
You're not going to be on every single day of your life, but accept it, listen to your body, and just know that maybe you're going to have a rest day. And today's just not going to be your day to go be shining in the world.
Yeah.
But take a rest and just put your feet up, read a book, chill. Like, it's okay. Like, just don't let that stay for weeks. Because then like you're starting to fall into a depression and you get, but a day or two, recoup and get right back up on it.
Exactly. And that's what I tell myself and my clients and stuff, because you know me being a trainer. I tell him, I said, when you don't want to go to the gym or you don't want to come and see me, that's the day you need to come and see me. That's the day you need it the most, and that's how I tell myself the days that I'm like, I'm not feeling it. I'm like, no, this is the day. First, I get in the word, I get in him, and then I push through and go and deliver, because that it's going to be powerful. It's more powerful when I don't want to do it, because it's coming from a powerful place, because I'm having to push myself through it, if that makes sense.
Yeah. So was your guidance in life then to you? Would you feel that was God speaking to you then?
Yes, it was. I can remember. That's why I said I had a relationship, but not knowing I had a relationship, because I can remember having conversations with him and just be like talking to him and him guiding me, but I'm not knowing, you know what I mean? Because I'm not that spiritual or that religion. I just, my grandmother had a strong relationship. My mom had a strong relationship. So I saw that. So I knew I can talk to him because they talked to him. You know what I mean? But him guiding me. So it was like a unconscious.
See, so my feel on that, because not everybody's going to understand that, and they're going to be like, well, I don't believe, or what, that doesn't happen for me, or I don't hear anybody, I don't have a conversation.
Right.
But I believe that we're all messengers in this world. So if God doesn't actually like speak to you, or because you're not open or like receiving, I think that message could also come up on somebody else coming into your life. So like my guidance counselor helped me graduate, and like really he was like, take my hand, I got you, I will guide you through, you will be okay. He had my back in high school and helped me build my career of like doing hair, and then got out into the world. And then I was lost for a while. I still opened up my own business at 22 years old. People told me it wasn't possible, or you're ridiculous, you're crazy, don't even do that. But I did. I followed my intuition.
Right.
I did what I don't like people telling me what to do. I mean, you tell me what to do, I think I'm gonna like just go and do it anyway.
Yeah, that's me.
I'm gonna up you. I'm gonna go, really? I can't? Watch me.
Yeah.
That's how I am. And then it took me like years later for somebody to come into my life and bring me into the personal development world.
That's
and then
good.
I hired a coach, and then I had a mentor, and like help like get me through. And I'm telling you, the universe, God, higher power, whatever you believe in, there is something out there that is guiding you.
Correct.
Set me up for success because when Taylor broke her back, I was strong enough to be able to handle what life threw my way. I had gained the strength in lifting weights. My nutrition was great, and my mindset.
That's good.
Unstoppable. And when I didn't see it then, but everything in life happens for a reason. I think if you could go back on and look at what happened in your past, it'll like be like, that's why that happened. Oh, that's why that happened.
Yep.
So you guys, for you listening out there, our listeners, just because you may not like believe in God or whatever, just know there is something out there that's guiding you. So that little like gut intuition, like you're feeling butterflies, you're feeling this, listen to that. It is trying to tell you something. And if you keep getting repeated something over and over again, like bad relationships, you can't find a good one, or your jobs like suck or whatever it may be, but it keeps repeating in your life, that is a lesson that God, life, the universe is trying to teach you, and literally is screaming at you, going, wake up.
Yes.
Like, this is not for you. There's something better out there. And I think they need to understand and feel that just because you're being repeated something over and over again doesn't mean that you're being punished. It just means that you have not learned the lesson that they were trying to teach you.
That is so true, girl. That is so true. Because we done bumped our head a couple of times. Circle and circle. I know I have. I was just like, okay, it's a wake-up call.
Yeah. For the ones listening on our podcast, they don't see our heads moving, but
yes.
100% yes.
Yes, exactly. And that's one that, I'm like, okay, I get it. But you're right. God, whatever you believe, it touch you in different ways, through people, through dreams, through because it's right here in your heart. What's in your heart is what you should be acting on. You know, because I always tell my customers or my friends, the enemy talks to the mind, God speaks to the heart. Because, you know, that's what, you know, all the bad thoughts and stuff is right here, you know. So, but if you doing that personal development, girl, I love that because I'm all about that personal development. But when you doing that personal development, you have the tools to fight off that negative thoughts. So that's
Can
good.
you imagine? Can you imagine if our teachers had personal development when they taught us?
Girl.
Can you imagine the lives that they could impact on little kids early on? But I believe that what happens is that our teachers don't have personal development and they have struggles in their own life. So maybe they were let down, so they're not going to believe in you.
That is so true, especially back then, too, because, you know, we're in a different time. And I know that different from now, they didn't know the difference between, because we all learn different. Like you said, you know, you have a different learning pattern. I do. We all have different struggles. I don't think they took the time. Now, there is a such thing as behavioral studies now, which I don't even know if they had behavioral studies back then. You know what I mean?
I don't think they did.
Yeah, because then they would have took the time and can see the difference in different individuals or students, you know. And that's where I think the system failed us at. You know, I'm not going to say they completely failed us, but in that form, I believe that's where they
did the best that they could with the tools that they were provided.
Yes.
It's just like us. It's like we do the best we can. But my thing is, like, you know, if you have personal development under your belt and you have health and wellness and like mindset and all that stuff, there's no excuses for you to be like, you know, not having a good relationship with your parents or your children or whatever, because we had the tools of growth and knowledge.
Exactly.
But when people don't have that in their lifetime, how are they going to be strong enough to handle the labels that you were dealt, or the doctor's telling my daughter she'll never walk again, and things like that? Like, we just have to have that strength and that power and that mindset has to be there. Like, that's key. Like, don't let people label you. Don't let people tell you that you're stupid or you're fat or you're ugly or you're not worth it. Or you'll be nothing without me or this or that. Like, you know, just stand in your power and work on you. And just know, look in the mirror and know that you're worth it, man. You're beautiful. You're powerful. You could do anything that you put your mind to. But it's in here. It's in here. Do not let the voices of the world take you down. You're going to rise up and become the best version that you could possibly be.
Amen. Girl, that's it. Yes. That's it right there.
So for everybody listening, I want you to leave them with a bit of knowledge or advice from you. Like, what advice would you give them? And what do you do? So if they wanted to get a hold of you and they wanted to follow you and stuff, we'll put tell me your Facebook and your Instagram and all that. Like, give that to them so they can go and follow you, and like just tell them like what you do.
So I'll tell what I do, and then I'll leave a nugget at the end. I'm a personal trainer, a group fitness instructor, and a certified nutrition. So I do health and wellness, mindset, body, spiritual, and soul. I try to tackle every last one of them. My Facebook page is Jeniece Page. I have BV Health and Wellness Facebook page. Instagram is
for a minute.
Okay, I'm sorry. Instagram is vegan_life_style. And then I have one for GR4TH. That's my podcast. I also have a podcast, Get Ready for the Dress. It's it tackles everything that I'm doing: health, wellness, mindset, spiritual. So that's my information right there. But what I want to leave you guys with is believe in yourself. We can take on this world. We can change this world. We are here to plant seeds for someone else. I'm about that seed. So when I say about that seed, because that's your legacy. our kids and our loved ones, but your legacy is people who you impact. It's going to be more than your family. So plant seeds. Be about that seed planting. Also, you want to personal develop yourself. If you're never done any personal development, like Jenny said, take that challenge. Take that challenge, because you're going to grow so much. You're going to learn who you are. And then when you learn who you are, you can be a better person to the next person. Not only that, because you're going to bring somebody up with you. It's all about, like I said, planting seeds. So you Jenny grabbed my hand. She said, join me here. I grabbed somebody else's hand, said, join me here. They grabbed somebody else's hand, and it's just a ripple effect. And that ripple effect is your legacy, because it started with you impacting that one person, and they going to impact somebody else. And so you're being the example, because that's what we are. We are examples impacting other people's lives and leaving that legacy. I'll leave you with this. My grandmother died in 2002. I wrote her poem. I wanted to put it on her obituary, but it was so many people that wanted to write, say something about her. I was mad. I was angry, because I was like, these people ain't her family. I'm her granddaughter. But let me tell you something. My grandmother impacted so many people's lives. We had the funeral set for 2 hours. It went for 4 hours, because there was a line at the door. I'm going to tell you how crazy I am. I'm sitting outside, me, my mom, and my sister, because we emotional, right? But God turned me around, and he said, look at these seeds your grandmother sowed. These are people whose lives she touched. People was running up to me I have not seen since I was 5 years old, saying, oh, grandma, I want to go say goodbye to grandma. And I'm looking at them saying, that ain't your grandma. That's my grandmother. God was like, they were there when you were 2,000 miles away. When you couldn't come and help her, they were coming to help her. My grandmother, she had kids from all over. And what I'm saying to you is, those was the seeds she sowed, and she didn't give birth to them. So they weren't her grandkids. They weren't her daughters. They were people's lives she impacted, that they wanted to stand in line for 4 hours to come and say goodbye to her. Girl, that's powerful.
Oh, that is beautiful.
So that's what I'm about, the seed. So you be about the seed, because that's the legacy. Because those people still reach out to our family today. That's her legacy. Not just me. Those people she impact. So that's what we need to be about, the legacy, the impact, the seeds.
So what book would you recommend? What book changed your life, or what started it all? What recommendation of a personal development could you leave them with?
I would, the one that I love, so I have two. I have, if I can share, No Matter What by Lisa Nichols is powerful. Her story is powerful.
She's good.
Yeah, and I can relate to her, because I can relate to her. And this is like my all-time favorite. You can see I got business book. It's T.D. Jakes. Basically, soar. So basically, just building your business and flying with it against the odds. Those are my two current powerful ones. Do you
listen to Les Brown?
Girl, yes, I listen to Les Brown. I listen to yes.
He makes me laugh.
Yes, he's funny. He is so funny. I can relate to him, because he talks about how they labeled him. Yes, I can relate to him.
I love it. He's like the power of laughter, and how that is, like, even though he's like inspiring and motivating people, he makes people laugh. Because you imagine what laughter does to us. Mm-hmm. So instead of having stress and crying, what laughter brings to, what it does to our body, our organs, everything. And I'm like, oh gosh, I love it. And literally, I'm driving and I'm cracking up. Yeah. I'm like by myself and I'm cracking up. I'm
telling you, it's just, life is, this life is great. I'm so honored and blessed just to be here. I just turned 53 this last week. But I was just like, I'm just grateful, because I'm still able to impact people. I'm still able to learn. I'm still able to do everything that I'm able to do, to God's blessed me to do. I'm still able to work out twice a day, teach 2 classes a day plus get my own workout in, because
and you don't have to.
Right.
You want to and you get to.
Exactly.
There's a lot of people out there that can't, but like that's what motivates me to work out, is that my daughter is limited. She does what she does, but she works out, right? So her leg, but I'm like, but I can.
Yeah.
I can do leg day. I can do that. So I do it for the people who can't.
Can't. Exactly. And that's the example. You're sowing seeds, being an example. You know what I mean? So it's a glorious thing. I just love life. I love life. There's a lot to be grateful for, and we should learn to be grateful for where we at. So while we're grateful for where we at, God or the university or whatever you believe will propel you to the next level in your future.
So you guys listening right now, just know that, with Jeniece's like struggles in life and her labels and everything that she's gone through, look at where she is today. We're not saying that what you went through didn't matter, because it does, but the past just doesn't matter anymore. You have to learn and find someone to help you, whether you go into therapy, whether you hire a coach or a mentor to help you work through those things, to understand that this is it. Draw the line in the sand today. This is it.
Yes.
It's a new start for you. It's a new day today. Yesterday's done. You can't change it. Forgive, let go, whatever. And today is it. Create a new life today and surround yourself around people that will uplift you and inspire you to be a better version of yourself every single day.
Amen.